Hi, and welcome to the Ethan King Foundation's first live YouTube web press conference. Today we'll discuss two programs that we have developed and are going to be launching, giving you specific data on where and when they will be launched. Let me begin by thanking all of the people that were involved in the research of this program. First of all, my board of directors who are here. Thank you, board. The Center for Disease Control in Atlanta, the Substance Abuse and Mental Health Services Department, Misha Key, California State Statistician, the U.S. Drug Enforcement Agency, the National Institute of Health, the National Institute on Drug Abuse and Methamphetamine, as well as the Journal of Gay and Lesbian Social Services. We would like to thank all of you for your input, for your data, for your statistics, and it is your research that helps make the decisions and swift to get in areas that need it the most. We are the HIV/AIDS Prevention Program. This program is currently in green, also available in 1-879-TRACK-9. However, to up the program, readily available. Our research, we could not combat HIV alone without adding one of its causing sources, methamphetamine. Methamphetamine, stimulant drug, increases state subpopulations and subgroups. Because of the attributes, public health officials are themselves at greater risk for HIV and other results using crystal methamphetamine in research among men who have sex with men, MSM. All assessments show that MSM who may increase their sexual risk factors, for example, themselves in having sex with partners, and engage in practice to elevate the virus. However, among MSM, sex to be higher, resulting in a greater risk of transmission. Methamphetamine users may exchange, creating another risk factor, acquiring and transmitting. Again, allow me to tell you, this is coming from the study. If you know anything about the adult entertainment industry remains safe while offering them an out when they are ready to. Our industry team is such a program and delayed through on computers and as assistants interview. With that being said, the fact that methamphetamine has been notated with users having sex for drugs and money, early methamphetamine, this makes it a #1 priority for our foundation. What is becoming clear is that the user of methamphetamine can contribute to sexual risk behaviors, and current data includes a between methamphetamine and sexual MSM, and perhaps a growing population of heterosexual and youth. Methamphetamine destroys the central system. It is a stimulant cast by the U.S. Food and Drug Administration as a to amphetamine, which means it has potential for abuse and psychological and physical dependence. There are numerous names for the methamphetamine, some of which are group specific. The most common: meth, tina, ice, and methamphetamine is injected, snorted, swallowed, inserted into the anus, amongst other things. The international is also troubling. According to the United States, meth today is the most abused hard drug on earth. The world's 26 million meth addicts equals the combined number of cocaine and abusers. Meth causes the body to release largely a neurotransmitter, resulting in a prolonged sense of pleasure of euphoria. For the user, over time, this causes severe side effects. With repeated use, meth depletes the brain storage of dopamine, eventually destroys the wiring of the dopamine receptors. This is a major reason why users become so addicted to the drug, and they are not able to understand the feeling of happiness or experience pleasure, which usually leads to a deep depression. In addition, it's a powerful stimulant that causes the heart to race and blood vessels to constrict, which can lead to a number of serious medical, including heart attack, stroke, and sometimes death. During these energy-fueled runs, which last days, users generally exhibit poor judgment and dangerous, hyperactive behavior. That includes affected sex, intravenous drug use, amongst others. Further, methamphetamine impairs the ability of the desire to be safe, both sexually and drugs. The impairment, in turn, lead to experimentation with riskier behavior than the user might generally participate in. Methamphetamine may cause and may lead to more chafing and abrasion. In turn, can provide an entry for the enter the body. Methamphetamine use is associated with sexual practices and may the likelihood of HIV and STD transmission. A quantitative study of gay and bisexual men in Seattle, Washington, Jose, California, from 1990 to 2001 revealed a high prevalence of drugs, methamphetamine, ecstasy, and GHB, often known as rape drug. In tandem with unsafe sex practices, many of the respondents reported said they had the HIV infection or AIDS and were medicating their symptoms, their drug use. Respondents reported engaging in continued unprotected sex as sex for trade for money or drugs. Studies show a high rate of methamphetamine use among them, again, men who have sex with men, than among the general population.